My name is Bartka, and today my presentation is about comparative analysis between Brazil and the United States. We will be comparing them on 5 key indicators. The first is health insurance mechanisms. The U.S. is a mix of private and public sources. In U.S., there are various types of private insurance plans. These plans offer different structures for accessing healthcare services and providers, and most of them are sponsored by the employer. This accounts for how 67% of Americans get access to healthcare. The U.S. government also plays a role in healthcare financing through public programs like Medicare and Medicaid. Medicare provides health coverage for individuals aged 65 years and older. Medicaid offers health coverage for low-income individuals as well as certain younger individuals with disabilities and is funded through taxes. Brazil is also a mix of private and public sources. They have a unified health system called the SUS, which aims to provide universal access to all its people. Approximately 75% of Brazilian cities do rely on the SUS. However, middle and high-income households tend to seek private care at a much higher rate. Healthcare costs. Healthcare costs in the United States have been a significant concern due to their impact on individuals, families, and the economy. In 2007, the U.S. spent approximately $2.2 trillion in healthcare, which is estimated to reach 25% of the federal budget by 2025. Several factors contribute to the escalating healthcare costs in the U.S., including advances in medical technology, an aging population, administrative expenses, and the prevalence of chronic diseases. The increase in healthcare costs have implications for individuals and families, particularly those who are uninsured or underinsured. They can lead to financial strain, limited access to care, and disparities in health outcomes. For Brazil, in 2019, their total health expenditures amounted to 9% of their GDP, with a significant portion of these costs being covered by private expenditures. Despite being one of the largest universal healthcare systems globally, Brazil's healthcare expenditures are considered relatively low compared to other countries. For instance, Brazil's healthcare expenditures are far lower than countries like the UK, Italy, Spain, the United States, and Mexico. Healthcare training. In the U.S., most medical schools, 59%, are public. Median tuition fees in 2019 were about $39,000 in public medical schools and $62,000 in private schools. Most students, about 73%, graduate with medical debt averaging $200,000. Roughly one-third of all professionally active doctors are primary care physicians, a category that encompasses specialists in family medicine, general practice, internal medicine, pediatrics, and according to some, geriatrics. In Brazil in 2008, they had about 450,000 registered physicians. Of this number, about 63% were specialists and 37.5% were general practitioners. The number of medical schools is growing exponentially, driven mainly by the opening of private institutions. Education and training at public schools are free. The poor quality of services in primary care is still a challenge. To address the problem, the federal government introduced a pay-for-performance program for family health teams in 2011. Quality of healthcare. The quality of healthcare in the U.S. has been described as uneven, falling short of expectations given the resources available. The country has achieved an overall score of 65 out of 100 across 37 indicators, indicating room for improvement in various aspects of healthcare delivery. Surveys and polls have indicated that a significant portion of Americans are dissatisfied with the prohibitive costs of healthcare. While improvements have been made in professional standards of practice and quality in indices and hospitals, challenges remain in terms of coordinating care, integrating systems, and updating technology. Brazil's healthcare system, anchored by the unified health system, aims to provide universal access to healthcare services for the population. Challenges do exist in the Brazilian healthcare system, including issues related to chronic underfunding, long wait times for appointments, and staff shortages. These challenges impact the quality of primary care services and access to healthcare for the population. Additionally, disparities in healthcare provision are rising since more individuals opt for private health plans, therefore creating inequalities in the healthcare system. Undergoing changes. In the U.S., the Affordable Care Act ushered in sweeping insurance and health system reforms aimed at expanding coverage, addressing affordability, improving quality and efficiency, lowering costs, and strengthening primary and preventative care and public health. The administration has also announced efforts to address high healthcare prices, especially concerning prescription drugs. 2 bills passed in 2018 that banned contracts between pharmacies and pharmacy benefit managers. These clauses prevented pharmacists from informing customers when the cash price for a drug was lower than the insurance negotiated price. In addition, to address hospital price transparency, federal rules require all hospitals to post their charges for medical procedures online and update the list at least once a year. Brazil's ongoing political and economic crisis has affected financing for all public policies and programs, including the SUS. That's why the federal government has promoted the unification of SUS financing for primary care, complex health services, pharmaceutical care, and health surveillance and management. The goal is to reduce bureaucracy and increase flexibility in how municipalities use financial resources at local levels. Also, the Ministry of Health has proposed new policies to strengthen and expand access to primary care, including the creation of a new secretary dedicated to primary care. These policies aim to increase access to family health units and to expand the use of electronic medical records. And here are my references. And thank you for listening. I hope you learned something. Bye.